Hey guys, it's Ellen Anesthesia. Today I'm going to be reading my personal statement that I submitted and got accepted into my CRNA program with. I want to say that writing an admission essay is a reflection into your own experiences and the future you hope to embrace. These can be extremely difficult to write, and thinking back when I rewrote this essay truly more than 20 or 30 times in over a course of 5 months. When I was awake and even sleeping, I'd be processing through words and sentence structures to evoke emotion and excitement from the reader. It was hard and grueling, but at the same time, it was a reflective process. I was able to be candid and clear about who I am and who I want to become. I remember sending in my first version of my personal statement. And honestly, I was a pretty good writer. I could just come up and randomly write about things that I wanted to talk about. But when I sent this person my essay, they destroyed it. They absolutely obliterated it. And I had to go back and rework everything that I worked so hard on and that I was confident about. But truly, through that process, I was able to write something that was honest to me and who I was. I had to rework, rethink, and revisit the person I am, and eventually I came up with what I'm going to read you now as my essay. First, I'm going to talk to you guys about what the criteria was for my essay, and for your guys' school, it's important to follow your requirements exactly to the T. So let's go ahead and get into it. So here's my criteria. Submit a 2 to 4 page essay, typewritten, double-spaced, and 12-point font. Now, it's really important that you format things correctly. They're going to be instantly opening up your document, and if their format's not correct, if you're single-spaced or using the wrong font, you can get your application thrown out immediately. So the next portion of it is the essay should describe your professional goals and how these goals will be achieved in the DNP program. Indicate how your past experiences and reflections have influenced those goals. So it's really taking a look at what you've been through and how you've changed from it. And that's really important because people are good at reflecting and saying, oh, I've been through this experience, but they're not also good at talking about how that made them better or how did it take away from them? How did it hurt them as a person? How did it help them grow? So the next portion is, have you been involved with any type of research, evidence-based, or quality improvement projects? For me, I have not been the forefront person for any of these type of things. So it's important that I didn't write about them. Because during your interview, it's important that you can elaborate and talk in detail about those things. Honestly, if you try to fake it, you're not going to be able to do that. And they're going to see that very clearly. Now, here's the last portion of it. Describe your understanding of the nurse anesthetist role and how obtaining doctoral education at my specific university will enable you to be a future DNP nurse anesthetist, and how you'll contribute to the nursing profession and the greater community as a whole. So as I'm reading through this, I'm going to be very honest about it. I have not looked at this essay since I submitted it last August. So all of these reactions are going to be real, and we're just going to kind of take it as a whole. So I'm going to pretend that I'm somebody reading this essay from the outside. So let's start. When I entered my junior year of clinical rotation, we were allowed to have an observation day with a specialty of our choosing. I decided that I would shadow a Certified Registered Nurse Anesthetist, or CRNA. So this opening part is, I'm really big on giving visuals to people, and I wanted to make sure that I was doing that right from the beginning. And I'm talking about whatever thing I'm going for immediately. Whenever you do say something where your phrase is usually abbreviated, you should definitely say the whole entire phrase, so Certified Registered Nurse Anesthetist, and then in parentheses you'd put CRNA in capital. And then any other time you refer to in the paper, you can just write CRNA. So that's also a big grammatical thing that schools will look out for too. I got to spend 2 4-hour days in excitement following them between cases and managing calls throughout the hospital. This initial exposure was overwhelming. Only 2.5 years of nursing school, the things that I'd seen were intimidating, challenging, and beyond what I would learn in my undergraduate courses. So in that portion, I wanted to reflect that the immense knowledge that I was at and the place where I was trying to go were extremely different. Like the things I was learning in undergrad nursing was to basically how to take care of a patient in a basic sense. Whereas as a CRNA, you are the sole provider of a patient. So that's a huge gap in autonomy, knowledge, experience, confidence. And being that student in my junior year, I didn't have any of that just yet, but I knew where I wanted to go. And I wanted to show that even back then, I was already thinking about this dream that I was going to have and going to achieve. When reflecting on this initial experience, the moments that stood out to me was the professionalism of the CRNA during patient interactions. During the preoperative phase, they are able to discuss the plan of care with the patient in a tone that eased their worries. Their goal was to communicate that they were there to bring comfort to their care, and this was seen with the calmness on the patient's face. In comparison, when discussing their choice of medications to the surgeon, they were able to display mastery of physiology and pharmacology. These are two very important interactions because they show how a CRNA is able to use their understanding of advanced concepts and their nursing background to have very clear and concise conversations regardless of who they're talking to. With the patient, they're able to really keep it in layman's terms and keep their worries and thoughts calm, and telling them that we are going to take care of you during this time. You are in our hands and we are responsible for you. And at the same time, they're able to go to the surgeon and say, this is what I'm going to do as a professional in this time that you're going to be doing your case, and how you're going to be able to effectively do what you need to get done during that time. The CRNA discussed not only why they had chosen specific medications, but how that would affect the patient during the procedure. Lastly, they planned how to proceed if an error or unforeseen circumstance were to occur, an efficient way to proceed to uphold patient safety. They stated that regardless of acuity of the case, they always prepared for the unexpected events and were able to act promptly when needed. So one thing I want to say real quickly is, where I said prepared for the unexpected events, in my essay that I turned in, I swear to you, I did not put events. So it read as, they always prepared for the unexpected and were able to act promptly when needed. So you could read it and say it like that, but you always want to be more clear. So mistakes happen, but don't let it be something that could detriment your admission to an actual school. The CRNA discussed not only why they had chosen specific medications, but how that would affect the patient during the procedure. Lastly, they planned how to proceed if an error or unforeseen circumstance were to occur in an efficient way to proceed to uphold patient safety. They stated that regardless of the acuity of the case, they had always prepared for the unexpected events and were able to act promptly when needed. So one thing I want to point out, guys, is that I actually made a mistake right here. So in here, it reads prepared for the unexpected events, where before when I submitted it, it said always prepared for the unexpected. And the important thing here is to always keep your mistakes that can happen to minimal and truthfully at zero. And the best way to mitigate mistakes is to have other people read your essays. Have your friends, your family, professionals, even get somebody who does writing as a profession to help you out. And that will have you have the perfect essay. Following that first shadowing experience, I knew that I wanted to have the same level of knowledge in the operating room. While at Nationwide Children's Pediatric Intensive Care Unit, I was able to experience 2 shadow opportunities from CRNAs who graduated from X University. During my second experience in the operating room, I remember witnessing a laparoscopic cholecystectomy and a Bianchi's procedure for short bowel syndrome. During these cases, I witnessed how disciplined the CRNA was even before the patient came into the room. They would check over the anesthesia machine, diligently confirming and adjusting the machine prior to and following both cases. Then they would draw up their medications, verifying their checks, then labeling them appropriately. I noticed that both CRNAs placed their emergency medications in specific locations in case of a drastic situation. For them, these were things that kept them prepared for all circumstances and was a step that was never missed. So during this portion of my paper, I wanted to talk about my shadowing experiences. It's really important for you guys to include that into your essay because that's what your admissions committee is looking for. They want to hear that you had this shadow experience and you might not know really what's going on. There's a lot that happens in these situations, but the big part is, what did you take away? What little things did you notice that the CRNA did, and how did they communicate it and how they worked to keep that patient safe and have effective communication with the whole entire care team. Following one of these cases, the CRNA was able to discuss a skill that was used during certain cases called peripheral nerve blocks. They explained this adjunct therapy allowed for long-acting pain control post-operatively, which allows for less opioid use during cases. The CRNA brought in the ultrasound machine and displayed a deep understanding of human anatomy. Between visualizing muscles, tendons, veins, arteries, and nerves, they were thorough in their explanation of what was being seen and what physiologic changes would occur following administration of medications used for sedation, analgesia, and management of cardiac function. Throughout my experience in the operating room, I saw how providing optimal care was not the sole responsibility of the CRNA, but a unified goal of the operating room staff. This was an environment where no individual is more than the team, a concept that will be a fundamental throughout my career. So a huge portion of this is that I talked about these experiences. This is what I saw and how I interpreted it. Then at the end of my paragraph, I wrote that all in together, and I kind of tied in a bow about how it affected me. What will I take from those experiences and how I incorporate that into my own practice? And that's how you effectively reflect, but also project on what something means to you. Because a moment in time is just a moment if you don't actually learn anything from it. So keep that in mind when you're writing your essay. The attributes that are integrated in the nurse anesthesia role are ones that are deeply reflected in X University's nurse anesthesia program. Certain characteristics are needed to be purposeful and efficient during cases, which is rooted in discipline. This ensures that throughout the procedure, things that are controlled are prepared for, and that unforeseen circumstances can be avoided or mitigated to ensure patient safety. Although when critical events arise, the CRNA conducts themselves in a manner that draws confidence and collaboration from the surrounding staff members. With self-awareness comes heightened understanding of one's environment and those within it, whereas maintaining discipline allows preparation. These qualities highlight the proactive and not reactive approach, which allows for improved patient satisfaction, reduction of adverse events, and optimal procedural outcomes. So one really big thing I want to talk about here is that when you're going through your list of schools and you square down where you want to go, you need to know what values are important to them. So my school has 5 pillars that are deeply rooted in everything we do, how we learn, how we act in clinical, and how we are going to be as professionals. So here we talk about the reactive and proactive approach. So it's important as a CRNA, and truthfully in any healthcare provision, to be a proactive person. Being reactive can harm the patient. We don't want to wait until the blood pressure is 20 over pulp and you're in a really bad situation, when before, if you would have prepared and given fluid, given blood, managed them a little bit differently, you could have helped that patient. So that's one of their pillars in there. Another pillar is discipline. So I wanted to invoke how discipline relays into the CRNA role. And I did so by talking earlier in my paper about the CRNA always bringing out their emergency education. And I also talked about the CRNA always making sure that the anesthesia machine is checked and properly running before the case. So here comes the last paragraph. This is the most important paragraph for me and one of my favorites to write. I love bringing everything I talked about earlier into one and closing it out and presenting it to whoever's reading. So here we go. Perseverance has been the foundation that has led me to this path. Since college, I had sought opportunities to learn more and ask questions, whether in the classroom or clinical setting. From conversations with many current and former SRNAs, I understand the sacrifices that there will be from late nights and early mornings, tedious repetition of information, and constant hands-on practice. With practice and dedication to the craft of nurse anesthesia, I intend to serve the patients by continuing to learn, teach, and improve discipline. The attributes of the care team involve integration, dynamic communication, and detailed plan of care. A proactive mindset are qualities that I aim to develop and embody throughout my career as a CRNA. I hope to be a healthcare provider who uses their skill set and knowledge to bring better outcomes to the patients and their families. I aim to allow experiences and others to humble me in hopes that I will be a better CRNA, not just for me, but my future colleagues and patients. I thank you for considering me and hope that I will have the opportunity to attend X University's nurse anesthesia program. So there, I really tried to encompass what it means to be an SRNA and then a CRNA. A SRNA is a student registered nurse anesthetist, and they are going to be dedicating almost all of their time to their knowledge, to their skill set, to developing who they are as a professional. And I wanted to promote that I understood that sacrifice. I'm willing to sacrifice whatever it takes to get to that point. But I also realized and put into my essay that as a CRNA, I'm going to grow through the time at the university. I'm going to grow through that experience, and I'm going to encompass all these things to promote the profession as a whole and to better our community, whether it be with our patients, their families, and all healthcare professionals. So I want to thank you guys for watching today. I really appreciate it, and I hope you guys will like and subscribe to this video. I'm out of here. Anesthesia out. Stay gassed.